You just need to tell next.
Yes.
Yeah. Thank you.
Good afternoon to all of you. I am Dr. Ravi Jaiswal from Raipur, and I am here to discuss about this paper, which is an integrated analysis of the efficacy and safety of entrectinib in locally advanced or metastatic ROS1 positive non-small cell lung cancer. So this was presented by Rafael et al., who is a Polish researcher. Next slide, please. So we know that entrectinib is an oral potent and a selective inhibitor at ROS1, NTRK, and ALK tyrosine kinase receptor. It is a CNS active drug. The highest potency is at ROS1, and it is more potent than crizotinib in the preclinical studies. It has acquired a pan-TRK inhibitor status. It is designed in order to cross the blood-brain barrier and to remain CNS active. Next slide, please. So we know that patients with ROS1 positive non-small cell lung cancer, brain metastasis is an unmet need. ROS1 fusions are oncogenic driver mutations which occur in 1 to 2% of non-small cell lung cancer patients, and brain metastasis in treatment naive patients is seen in 36% of the cases. The current standard of care for this group of patients was crizotinib, and now this NTRK entrectinib has also come into the picture. The earlier crizotinib was approved based on the profile 1 data, which showed an overall response rate of 72% with a median progression-free survival of 19.2 months and the duration of response 17.6 months. And we know by using crizotinib that it does not have a very good CNS penetration, and most of these patients had progression in CNS, that was 47%. Patients with ROS1 positive tumors would benefit with a drug which has a CNS penetrant ability. Next slide, please. So with this background, this integrated analysis of 3 studies, that is STAR TRK2, STAR TRK1, and ALK 372. The 2 studies below down are phase 1 dose escalation, which had 7 and 9 patients. Majority of the patients were in STAR TRK2, which had 145 patients. So it was a global study, multicentric, prospective data, which had patients who were ROS1 positive and who had more than 6 months of follow-up. They included patients who were ROS1 inhibitor naive. The dose of entrectinib was 600 milligrams OD dose. The primary endpoint of this study was overall response rate and duration of response. The secondary endpoints being progression-free survival, overall survival, and intracranial response rate. Next slide, please. So if we look at the baseline characteristic, 54 was the median age, majority were females, there were equal Asians and the white population. Majority had a performance score of 0 and 1. They were never smokers. Adenocarcinoma histology. What is interesting here to know is the prior lines of systemic therapy these patients got. So 39% of the patients had more than 1 line of therapy, and 23% of the patients in this group had more than 2 lines of therapy. The other remarkable thing is 34% of the population had CNS disease at baseline. Next slide, please. So we are talking about this population, and if we look at the objective response rate, that was the primary criteria, it had 67% of objective response rate. The interesting thing to note here is that 8% patient had complete response, and even the patients who had CNS disease at baseline, 7%, that is 4 out of 56 patients had a complete response, which is quite remarkable. If you look at the clinical benefit rate, it is 75%. So majority of patients had a partial response and a few of them had a complete response. Next slide, please. If we talk about duration of response, it was a lasting duration of response. The duration of response was 15.7 months. And if we look at the group which did not have a CNS disease, this patient had a 24.6 months of median duration of response. Next slide, please. Progression-free survival was 15.7 months in this study. Next slide, please. Overall survival of the entire population of cohort was not reached. For those patients who had a CNS disease, the median overall survival was 28.3 months. Next slide, please. To talk about the safety of this drug, yes, it is a safe drug. Majority of patients had grade 1 and 2 side effects like loss of taste, dizziness, constipation, or weight gain. Hardly 2 to 3% of the patient in the population had a grade 3 and 4 toxicity. The important things to note here is a weight gain, AST elevation, that is your deranged liver function test, and hyperuricemia. So these three were the toxicities which were significantly grade 3 and grade 4, which led to treatment discontinuation was only 3%, and 27% of the patient had a dose reduction. So overall, it is a safe drug. Next slide, please. The most important thing to remember, once again, I'm highlighting that the majority of the patients that we are talking about were heavily pre-treated. So 63% of the patient had more than one prior line of systemic therapy, and 35% of the patient had CNS metastasis at baseline. So we are highlighting a relatively poor prognostic population in this study. Next slide, please.
Dr. Ravi, just finish in 1 minute.
To conclude, the overall response rate from this study was 67%. The responses were durable. The 12-month duration of response was 63%. 12 months progression-free survival rate was 55%. And the 12-month overall survival, the median could not be reached. Significant intracranial response rate, that is 53%. And for the patients who had a measurable CNS disease, it was 80%. So entrectinib is a tolerable drug with a manageable safety profile. Thank you so much for your attention.
Thank you, sir. I would like to invite